I actually was a semi-professional magician for years at university, and one of the approaches for magic is actually to see the effect that you want at the end and then work back to how you can make that possible. So to be honest, I think a hobby of mine, magic, has really helped in thinking about how do you innovate and solve difficult problems. I'm Dr. Matthew Bromwich. I'm a pediatric ear, nose and throat surgeon and associate professor at the University of Ottawa, and I work at the Children's Hospital of Eastern Ontario. I'm also the chief medical officer and founder of Clearwater Clinical. The idea behind SHOEBOX came from a time I was in Iqaluit at the hospital there working with kids with hearing problems, and we were having difficulty obtaining a valid hearing test. And so we were flying these kids down from Iqaluit to Ottawa at great expense, about $4,500 a family, to get a very inexpensive test, which just didn't make sense. And that happened back in 2010 when iPad first came out, and so I was thinking at that time, well, could we use the iPad as a medical device that's very portable and obtain an easy hearing test using a touch interface or a game interface? The hope at that time was to put all that into a small container about the size of a shoebox and send it where we needed to go, which is why we call it SHOEBOX. Normally you don't get your hearing tested at your family doctor's office, and yet you should. You get your blood pressure checked, you get your eyes checked, why not your hearing? And so with SHOEBOX in primary care, again, you enable them to provide better health care closer to home.
The innovation that Matt really developed was to enable anyone, anywhere to conduct a valid hearing test, and the potential of that is incredible. You know, there's 466 million people around the world with hearing loss today. We have a 50% shortage of specialists to do audiological testing, but that number is going to get worse and worse over time as our population ages. So really this innovation came along at the right time to help address the shortfall in hearing assessment specialists that there are today and grow that, you know, to a worldwide audience.
Once upon a time in schools, a nurse might have done hearing testing, but unfortunately, school nurse has gone away. And so children who are at risk of hearing loss don't get tested anymore, and they really should, because if you can't hear, how are you supposed to learn? So when you hear the sound, give me one of these.
My name's Jacob Blackburn, and I'm 17 years old. Having SHOEBOX is amazing. For younger kids, they had that part of the app where you click on the picture and then it moves, but then there's also another part where you can be like your own audiologist, and like you use the gram and stuff and you move it up and down, and then if you can hear it or if you can't, then you make your own audiograms. It's
surprising that hearing loss isn't more talked about, to be honest. It's the third most common cause of disability in Canada. One of the side effects of hearing loss can be isolation, because you're not talking as often, because you're missing the joke, you feel awkward, and isolation leads to depression. Last year I went to Peru as part of a medical mission with Worldwide Hearing. Being able to bring your innovation with you and see it work was just enormously satisfying, and I think I really enjoyed getting the feedback from them, but also being able to help them and see something that I was involved in developing in the real world. So we really feel that upstreaming this type of care to the family doctor's office is an important part of general well-being in Canada.